I thank you for coming back to the conversation. We are talking about sickle cell disease with a physician and young adults who aren't just living but also thriving despite the pain that comes with this disease. Kyle Registry had gene therapy to treat his sickle cell, and now he advocates for men, women, and children with the disease through his business, Privileged Pilots. And Dr. Jason Payne is a college professor and a pediatric hematologist. And joining the conversation now is Larissa Williams. She is a senior at Oglethorpe University studying film production and theater. And Nazir and Adonisha Atlas are siblings. They both have sickle cell disease and have really learned how to support one another through the crises and other obstacles, but also cheer for each other. Yes, indeed. Welcome to all of you here. I know you had a chance to hear Kyle's experience. Did that sound familiar? Yeah. Just tell me what this was like for the two of you.
Well, we will say we've been offered the bone marrow transplant before, but we decided against it. And the reason why is because not many people are educated about it, and they think it's the end-all be-all cure, but it's not, and it's just a treatment. And they don't realize the process for that is to go through chemo, to kill your bone marrow, to get a matching donor's bone marrow, and then you have to count the risks that they may, attack your body as well.
Right, so let me pause you right there, because Doc, I want to give you a chance to explain further, and then we're going to come back and I want to talk about the childhood experiences.
Yeah, so I think you're absolutely right, bringing up those risks that are related with getting things like gene therapy. So before you can get gene therapy, you do have to use medicines like chemotherapy to get rid of the native immune system, the ones that are programmed to make those sickle cells, so that when they get the donor cells, there's room for those cells to take shop and then start replicating, making those new cells that don't make sickle cell.
So is it a cure or a treatment, the bone marrow and the gene therapy?
Yeah, because we are actually changing what those stem cells are doing, getting rid of his current stem cells and getting a donor stem cells, he will no longer make those sickle cells anymore.
Understood.
And so the effects of those sickle cells are going to be different because they're no longer present.
Understood. But for you, you two just felt like the risks were just too much. You just didn't.
Because we didn't want to change one issue that we already know our bodies. We know what we're going through.
Interesting.
And if we get new issues, especially the infertility being a high risk.
Is that true?
That is absolutely true.
Understood.
Yes.
Being a super high risk, I didn't want to risk not being able to
have babies.
Yes,
Understood.
exactly.
Nazir, for you, I mean, what was this like for you as children?
I would say it was very hard. I mean, it was just me and her, so we had nobody else. I mean,
and you actually have a twin.
I do.
But the twin does not have sickle cell.
No, he just carries the trait.
Yeah,
understood. So that made the two of you two could sort of relate in a way that maybe sometimes other children could not, right? Larissa, for you, this experience as a child, the trips to the hospital, that's what you experienced, right?
Yes, it is very much so. Just not being able to do as much as my peers growing up, having to miss out on a lot of childhood experiences because of sickle cell is very real and understandable.
And I've heard that just even the things that people sort of take for granted, taking 4 years to graduate from high school, college, right? Explain.
So when it came to me going to school, I didn't graduate on time. I graduated in my year, but I graduated in July instead of May because
I was so much school.
Yes.
Is it? Yeah.
I was in the hospital. I was hospitalized during the midterms, which I had to retake. And then when it came to the final exam, I made my grades go up to the point to where I had A's and I didn't need to take a final exam.
And I understand sometimes that there's just a lot of doubt, right? People are like, oh, you can't be that sick. You're missing school again. Is that really, was that an issue for you, Kai?
Yeah, that's always been an issue for me. And, I tried to always be very open about it because, you'd be out of school for 2 weeks or so, and there's really no hiding it. Your friends and your peers are asking you, hey, where have you been all this time? And I'm like, I've been sick. I've been dealing with sickle cell. Your teachers are kind of having to explain to them what sickle cell is because nobody goes and does the research for themselves. You always kind of have to teach somebody about sickle cell disease, as well as your friends. You want to teach your friends what to do if you have a crisis. So, you know, they know what to look out for.
And Dr. Payne, how much is that patient advocacy, you know, especially when they're young people, how do you and other physicians help patients learn how to explain, I'm not faking, I'm really in pain, this is serious, and even with other healthcare providers?
Yeah, I think a lot of it has to start really early. So when we first see them as patients, getting the parents really involved in their care.
And is that usually like an elementary school age, preschool age?
We have patients that are learning as toddlers about what their sickle cell disease is because they're experiencing those crises at those ages.
Yeah.
And so you can't avoid it. So you kind of have to like name it and let them know that unfortunately you have sickle cell disease and this is why we're going to the hospital. This is why you have to go and get a blood transfusion or go get those labs done, which is, you know, that's very scary for young kids.
Kyle described it as having something tied around one arm and just the pressure and the pain. Is that similar for what you experienced?
It's definitely similar. I've described it as someone having a big, huge metal door and slamming it against me repeatedly.
Wow. Does it
the throbbing pain
and flow? Does it come and go?
Absolutely.
Tell me more,
I
Melissa.
feel like relaxing. It makes you feel it more. I tense up trying not to feel it, and then as soon as I release, I feel the throb kicking again.
Is that the same experience for you?
Yes, but also there are some days where it can start maybe like in your arms and work its way down and just migrate to other parts of the body. It's really unpredictable.
And so are there pain meds? What do you do to manage until it just works its way out of the system?
Well,
I want to hear from Nazir on this one. Nazir's so
mean,
quiet.
yeah.
All you can do is really wait it out. Use heating pads, or when you take your medicine, there's a certain amount of time before you take it and it actually starts working.
Yeah.
And when it does start working, you'll know it starts working, but it's not like an off switch.
Gotcha.
It's like a flame dying down.
Oh my goodness. All right, we're going to pause right here because I want to make sure that you understand. In spite of everything these young people are dealing with, they're also thriving and they're doing things in the community. We're going to talk about that when we return.